Hi, my name is Greg Felt. I'm Director of Public Health in Sheffield. This is a epidemiology situation report today, the 4th of October. In a word, flat. Holding pattern, our 7-day rates in the order of 300 to 350 per 100,000. I think that will oscillate up and down a bit over a period of time. All of the expectations are that will go up significantly over the course of autumn and then into winter. We're 10 times higher than we were this time last year. So it isn't all over. The over 60s rate is a sort of a nationally is a north-south divide, much higher in the north than the south, and ditto for Sheffield, there's an east-west divide, much higher in the east than the west. It's the over 60s that still concern us most because they're the most likely group to be made significantly poorly. So the trends, as I say, overall, it's relatively flat, oscillating a bit, up a bit, down a bit. Generally a downward trend in young adults, an upward trend in children, the last group to be vaccinated in significant numbers, and therefore they're the least well vaccinated, so that the trend is going upwards, and what we're seeing is large outbreaks in schools at the moment. It's important that we do get vaccination into children, and that's happening at some speed now. The tiny rise in the over 70s, which isn't terribly concerning, but keeping a very, very close eye on that one. But what we're seeing is sort of significant uptick in rates in children, the vast majority of whom just aren't poorly, beginning to rise in parent-age children, so the stacking up through the age groups, and we're just keeping a very, very close eye on that one. The thing that has and continues to make the difference is the vaccine. The city's done amazingly well with regard to the number of people who are now fully vaccinated, but it's worth remembering that there's sort of well more than 10% of the adult population who haven't yet had dose 1, and if that's one of you, I can only encourage you to get that as soon as possible, because COVID rates are high. There's a chance it will find you, and certainly for the older people amongst you, there's a chance it will make you significantly poorly. No one wants that. As I say, we're flat, holding. We think that we'll be in for a difficult autumn and winter. Don't know how that will play out. Now, all bits of the NHS and social care are beginning to feel the normal autumn and winter pressure. COVID is adding to that, and the last thing we want to do is make it any worse than it needs to be. So if you haven't yet been vaccinated fully, please do so as soon as you possibly can. All of the normal preventive messages apply. Most importantly, if you have symptoms, stay at home, arrange a test and act upon the results of the test. Wash your hands, wear a face covering, open the windows, etc. Those things aren't changing very, very much. But as I say, the most important thing is if you haven't yet had dose 1, please do so as soon as possible. On vaccinations particularly, all of the evidence is telling us that those who are in hospital now are almost universally the non-vaccinated group. So it's important that if you haven't yet had your vaccine, please do. Boosters. So booster vaccines are now available for people who are most at risk from COVID-19, who've had their second dose of the vaccine at least 6 months ago. They'll be offered in the same way as we did the first and second doses, basically working through the priority ordering groups as we did previously. So we're starting with the over 50s and health and social care staff and those who are clinically extremely vulnerable. So more information about eligibility will be at the end of the video. If you're eligible, you should be able to book via the National Booking Service, and again, details at the end of the video. If you're struggling to book, please pop in to a walk-in clinic, and there are plenty across the city. Take evidence of your eligibility, such as a text message or letter, or if you're a health and social care worker, bring evidence of your employment, your staff badge, for instance. If you're invited, please do take up the opportunity, because booster vaccines help give you longer term protection. Walk-in and pop-up clinics are available across the city. This week we're at the University of Sheffield today and tomorrow. We're encouraging from 11 till 4 p.m. at the University Concourse. Students and members of the public are welcome. We're also at Burnbury Vestry Hall from the 7th to the 10th, 11:30 to 6:30. And obviously Sheffield NHS Vaccination Centre is open 7 days a week for walk-ins between 8 and 6:30. That's at Longley Lane, just adjacent to the Northern General, and all of the information is available on our website. Flu, lastly. There are 2 vaccines that we're recommending people have this winter, flu and the COVID-19 booster. You may also have been invited for your flu vaccine, and again, I encourage you to take up the opportunity as soon as possible. Flu is a nasty illness and harms people every year. If you've had COVID-19, it's safe for you to have the flu vaccine. Obviously, it helps prevent flu. You can get flu and COVID at the same time. It doesn't sound like a very happy combination, and I'd encourage you to protect yourself against both diseases. You can actually have both vaccines at the same time, and more information about the eligibility for all of the winter vaccines is available at the end of the video.